It's my pleasure to welcome you to the Pan American Health Organization, the World Health Organization's Regional Office of the Americas. And a special welcome to the university rectors, professors, and program coordinators from the Coimbra Group of Brazilian Universities, CGUB, we'll be talking about later, and others who are participating in Day 2 of this 4th University International Seminar entitled Universities as Agents of Change, Innovation and Socio-Economic Growth. We'd also like to have a special welcome to our distinguished speakers and panelists for later today, and for those from yesterday that are able to join us. And one of our speakers who's joining us virtually from South Africa. Also staff from our partner organizations, the Organization of American States, and our staff here at PAHO, and invited guests from external organizations, GW University, NAFSA, who are coming here for this morning session that's the specific focus is going to be on health. Those that are joining us today for the first time that weren't with us yesterday, I'd like to recognize our partners and co-coordinators of this seminar. Rosana Silva, whose nameplate is here and you'll meet her later, who is with the Coimbra Group of Brazilian Universities. Nelly Cochicoa from the Organization of American States, who is coordinator of cooperation with Latin America in the OAS Department of Human Development, Education, and Employment, and also general coordinator of the OAS GCUB PAHO at the OAS. My colleague, Dr. Luis Cuervo, who is here someplace, Dr. Luis Cuervo, who is a senior advisor for research for promotion and development at PAHO. And there are many members of our team from OAS and PAHO who are here with us today and have been integrally involved in preparing this event. As PAHO's Deputy Director said yesterday, Dr. Isabella Danel, this partnership is important to PAHO for many reasons, 3 of which stand out, and I think they bear repeating. This partnership is helping to build human resources for health. In just 2 years, nearly 200 scholars are being trained in graduate degrees on health focus. This partnership is also promoting effective research and also supporting innovation through interdisciplinary collaboration. All of these areas, or these 3 points, are necessary to strengthen health systems and support PAHO's goal of universal health, which is also one of the targets of the Sustainable Development Goals for health. This morning's session will focus on innovations resulting from this type of interdisciplinary collaboration. Before we begin, I have just a few housekeeping notes. You'll see everyone should have an agenda. If you don't have an agenda from yesterday, there are extra copies outside. Page 11 is the agenda, and we're going to follow it closely today. To help us follow the agenda, we actually have you'll see lights going on in the back to help our speakers as far as their timing. Most people will be giving presentations about 20 minutes and allow us time for question and answer, as discussion is and dialogue is important in this session. There are restrooms outside on the right, on either side of the elevator. And I'm going to ask you to take out an innovative tool that I assume you all have very near and dear to you, your cell phones, which are not a health tool officially, but as you know, we use very often in e-health and telemedicine. So please take out your cell phones and silence them for the day's activities. Now I'd like to begin with welcome remarks from one of my colleagues who has been instrumental in making this partnership a reality. And I would say he's one of our innovators here at PAHO, Dr. Luis Gabriel Cuervo. Dr. Cuervo is a medical director who graduated from the University Javeriana in Bogota, Colombia. His career began as a clinician, a researcher, and an academic, where he championed the development of systematic reviews and promoted evidence-informed healthcare and other ways of integrating scientific research with healthcare, prevention, and policies for health. In 2000, he moved to the United Kingdom to work with the British medical journal's Clinical Evidence. And he was seconded in 2004 to WHO to integrate scientific research into the selection of essential medicines. And he joined us at PAHO in 2005, where he was appointed the unit chief the Senior Advisor for Research Promotion and Development at PAHO. In this role, he has coordinated the development and consultations for the policy on research for health, which is in your folders that you received today. He now focuses on working with strategic partners to make this policy a reality for the countries of the Americas. So given his background and his expertise, you can see that it's appropriate that he welcome you this morning on this session on social innovations in research for health, an opportunity for universities. I'd like to give the floor to Dr. Cuervo.
Muy buenos días. Good morning. We're delighted to have you all here. And I want to welcome you to the Pan American Health Organization on behalf of our Assistant Director, Dr. Francisco Becerra. As you all know, with all the Zika crisis that we're going through, he was asked on Friday to travel kind of urgently, and I'm very sorry to not have him here because he's a tremendous advocate for the use of research in health and for health. We just saw a video. Most of you have seen that video, and probably some of you have seen it before. We have another one that's going to be playing during the break about Chagas. That video was produced by a student, an undergrad student. She's a painter. And I love that video for several reasons that touch directly into the subject of this gathering today. Because when you look at the video, this one, the one about Chagas, or this one about hookworm disease, one tends to think that it is about a disease. But as she takes us through the video, with all the research she did to produce it, we can see that it touches on every aspect of a health system first. So it is talking about a disease that makes it difficult for kids to go to school and to learn. But then, as we go through, we learn that it has to do also with the fact that they don't have shoes, that it has to do with the housing, that it has to do with the water that they have access to the education system. And as you start looking at the video, you know that it touches on everything from the delivery of medicines to the delivery of sustainable environment and conditions, to dealing with chronic diseases, to dealing with acute diseases. But then you look beyond that and you see all the determinants of health quite nicely exposed there. So if this kid doesn't have that ability to learn, we are getting into a cycle of poverty that is keeping our countries behind. And I think this touches into part of the conversation we were having yesterday on how just by changing some little things, we can make a huge difference. And many of those changes are not going to come from the health sector, either because they need interventions to other sectors, or because we need different ways of doing things. The biggest innovations we know, such as the telephone that Karen showed us here, are possible when we bring together science and arts. Computers were the result, and the network and all that were the result of a lot of different scientists coming together, but with different ways of looking at things. I think we have all witnessed the tension between those that want to give free access to software and those that want to have, for example, hardware that is closed in its copyright. And that has been a healthy tension that has enabled the development of new machines, and at the same time, the development of better and better software that people can tweak and use in different ways. And that is just one of the examples. And a lot of what has been happening with computers and with the web and all that came from the inspiration of a woman in the 19th century, Ada Lovelace, who thought, how could people work better with machines? She was the daughter of Lord Byron, a poet, and a mathematician. So that beautiful combination of science and art helps to do much better things. And the great successes that we've seen in the development of all the technology revolution that we have witnessed in the past 30 years, quite frequently has happened when we put people with different ways of looking at things in the same spot, working together, not necessarily by Skype, but building trust and working together. That was a great success of Bell Laboratories, for example, in pushing forward the development of a lot of things like transistors and microprocessors. And now we are looking at how those are being used to enable people to have better access to healthcare, to have their medicines on time, And perhaps you may have seen some of the applications. Now we can know if we're having sleep apnea just from our telephone. We can know how many hours we're sleeping. We can know if a person has a problem in their eyes, and so on and so forth. So there's so many opportunities. And in the past year, we've been working with tropical disease research, a laboratory from the World Health Organization that has been supporting capacity building to address neglected diseases, those diseases that we should have wiped out because we have the capacities to do it, but they're still there. For example, malaria or Chagas or so many others. I'm working with them and in a partnership between the University of Oxford and the University of Cape Town, which is a very interesting partnership because, by the way, their centers are not based in the medical schools. The centers for innovation in those two universities are based in the business schools. So it's the Side Center in Oxford University and the Bertha Center in the University of Cape Town. They're looking at how to generate solutions that contribute to health and development. And they are supporting these kind of innovations, and we want to actually scale that up in the Americas. And that was one of the reasons why we thought it would be wonderful to have you here, because we want to inspire the universities from Brazil and from Mexico to begin with, because those are our strongest partners at this moment, and we are building capacities of human resources there. We want to put everything on their hands as possible so that they can do the best work with innovation and with doing research that makes a difference. So we are very happy that 2 years ago we signed this agreement with the Organization of American States, and that has been so successful that we have 183 people doing masters and doctorates in Mexico and Brazil, because we know that's going to change the way things are done and that we have champions. We have ideas like the ones that TDR is proposing. I'll use one as an example in a minute, but we also need champions, and that is a great opportunity because those people that are doing masters and doctorates within a couple of years are going to be the advisors to the different sectors, whether economic, whether commerce, health, science and technology, education, so on and so forth. And in very little time, they're going to be making a difference in their countries if they're not already making it with the work they're doing. We want these scholars to become real agents of change. And we want them to do it the best way possible. So what PAHO is bringing to this partnership is not just opening to the health sector, but we will present this afternoon a whole array, a toolkit of resources that will enable any of those scholars to do the best possible research for health. It doesn't matter if they are engineers, if they are artists, if they are working in media. Those tools will be useful if they want to do research to impact in health. One of the 25 projects that TDR is supporting is called Writers for Health. It's right down on the bottom right. I love that presentation when they did it. There's a short video of 8 minutes, but I'm not going to show it now. But I loved it because this was about a country, and now it's in multiple countries, in Africa, where people were not having, the healthcare providers were not being able to reach the spots where they needed to be. They were using old Land Rovers to get there. When I did my social service in Colombia, I worked in the jungle, in the Pacific coast, and we went around also in a Land Rover. It is an expensive vehicle to have in our countries. It goes everywhere, but it uses a lot of gas. And typically, it's the driver and the dentist or the doctor or both of them, and the rest of the car is usually empty, just a box with the medicines. Well, someone that had worked in the transportation system went to these countries and said, this makes no sense. This is a very expensive way of getting around. We just kind of inherited, and we've been doing it all our life like this because everybody has been using these Land Rovers all their life. This could be done differently. So this person thought about motorcycles. But the thing was not just getting motorcycles there. That is easy. You can buy them, and there you have them. It's how to make it sustainable. So this involved also thinking about training a cadre of people in being good mechanics with the motorcycles so they could fix them anywhere they were, and following a scheme similar to that one of EasyJet or any of or Goal or any of these cheap airlines where all the airplanes look alike. Well, they bought all the same motorcycles, they tested the models, and so now they have a good stock of parts, and this is having a huge impact in the healthcare in those countries. But it's a solution that doesn't come from the health sector. It's a solution that came from someone that had management and business perspective, and that's from another person that has all the knowledge about how to train people to be mechanics, but it's having a huge impact. So we want to spark more of these solutions. That could be the project of a scholar doing a master's perfectly well. They could measure the economics. We could look at figures like the ones we had yesterday showing us that we have direct returns from training someone on a doctorate in just 8 years through tax money having recovered the investment that the country made. Not to mention all the impact that this has in the family and the people around the people that do their masters and their doctorates. So that I can speak from my own personal experience, but knowing many of you here in the room, I am sure that it has had the same impact in your lives. When you have the opportunity of doing a master's or a doctorate, it's not just you. Your whole family gets a benefit. Your whole community gets the benefit. And you have an impact that you cannot actually measure. I love research. We measure everything we do. But not everything that is important can be easily measured. The happiness, the development, some of those things you can indirectly measure, but many of the things we know they happen, but they require 20, 25 years to mature to see the huge impact they might have. Opening the world to these scholars is going to completely transform their communities. The networks they're doing now in Mexico and in Brazil, and we hope that in other countries soon, are going to promote the best use of research around the region and solutions for all. We think this is a great way of achieving health with equity, and that is why the organization is fully behind it. The assistant director, the director, the deputy director you heard yesterday, we all believe that this is a great way of working together and getting the most of the partnerships that we can bring, the best of the Organization of American States, the best of our partners in Mexico and in Brazil, and the best that we can bring to make a huge difference. So we want to welcome you today, and throughout these sessions, you are going to listen to and have the opportunity to interact with people that have been champions and protagonists of change in universities and other places, and how their universities have benefited of being the key players that they have been for doing all this, how they have managed to change the way we do things to do them in a better way. With this, I want to close my remarks and welcome you all, and thank you very much.